All right, good morning, everybody. It looks like everybody's just starting to jump on this morning. My name is Chelsea Rosty, Director of Business Innovation from the City of Montrose. I've got Dr. Joe Adragna here, and he's got a lot of titles, which I'm just going to let you share when we get to your portion of it, but definitely Dr. Wonderful MD here in our community. And then I've got Kate Adams here with us, who is our wonderful moderator and DART program assistant for the City of Montrose. So more and more people are starting to jump on the webinar. We found that it takes a few minutes to sort of get everyone joined. So if you want to say hello in the chat function at the very bottom of the screen, just go ahead and type hello and what business or organization you're joining with. And then if you have questions throughout, this webinar is really designed to be heavy on Q&A this morning. We want you to get your specific questions about your business answered. So please feel free to type those into the Q&A, and I'll be moderating those questions throughout and helping Dr. A with that. All right, as we're just waiting for everybody to join, wanted to say good morning to Trisha. Thanks for joining us. Jodine, welcome. Good morning, Henry and Daniel. Carol from Museum of the Mountain West, welcome. Joey, Margot, Vanessa, Matthew, Kim, hi. Welcome to everybody. Thanks so much for being here. It looks like Lori from Senior Care Pace VOA. Thanks for being here. All right, so again, I know we've had a lot of people join sort of in the last couple of minutes. My name is Chelsea Rosty, Director of Business Innovation from the City of Montrose, and I've got Dr. Joe Adragna here joining me. I'm going to be sharing my screen this morning to talk a little bit about what things look like in the timeline of just from today until May 4th. And so that's a shortened, it's just a week timeline as our economy begins to open up just a little bit. We're transitioning to open. We're not just hitting the start button and having everything go back to normal. That's certainly not the point of what we're here to talk about today, but we are going to share a little bit about what things are going to look like. And Dr. Joe is going to give us a lot of great information on how to be able to do that safely. So give me a moment here as I go to full screen. Okay, so today is April 27th. So according to the governor of the state of Colorado, this is the first day of Safer at Home. So this is a transition from safe at home, or otherwise known in other communities as sheltering in place, now to sort of a phased introduction to the opening of our economy and the community. So today, retail, which has previously been considered as non-essential, retail can begin curbside. So that's taking an order over the phone or online or in person with social distancing, and having the order being brought out to the curb and taking payment electronically would be the preference there. Real estate can begin showings, one-on-one showings. Open houses are not permitted at this time. So that is where we're at with April 27th. A caveat to the Montrose community is that car washes may also open today. So that's probably really great news for those of us who need our car washed, but also great news for car wash owners in the community. And I know I've spoke to several of you car wash owners, but if you know anyone who owns a car wash and might not have this information, please help us share that. Okay, so then transitioning to Friday, May 1st, and this is where there was a little bit of confusion when the first information came out. On Friday, May 1st is when retail, full retail, can open with proper social distancing and health practices in place, and then personal services with those same type of precautions can open. And so that personal services includes your beauty salons, barbers, tattoo shops, one-on-one personal training, and the like. And so something that we've received a lot of questions about are services or personal services such as a dance studio, or Amazing Glaze would be a great example of what does that look like, because classes are offered. And we've spent a lot of time talking about this as a team between the city and the county, and Dr. Joe can chime in too later if we have more questions about this, but we really feel if a business like Amazing Glaze or even a dance studio can safely social distance with a group of 10 or less, which includes the instructor or the business owner, then that would be permitted under this order beginning May 1st. And so that means 6 feet apart from one another. That means proper hand washing and all of the things that Dr. Joe is going to talk about. And we can answer more of those one-on-one questions later too, but just to sort of give you a thought about what that looks like for personal services. Then we get to May 4th, which is next Monday. And you will see here where offices can reopen at 50% reduced capacity. If you remember back, we had this at the beginning as we started to transition away from full opening. And so this means that if a business has 20 employees, that 10 of the employees should be at the office at one time. And so telework should be continued as long as possible in an office setting. Manufacturing will start to look like maybe staggered shifts where half of the workforce is coming in one shift and half of the workforce is coming in on a second shift or even a third shift, those type of things, congregating in break rooms, all of those type of things. And so that's sort of a timeline from today until May 4th. We realize that this is going to be happening really quickly, and that as business owners, you're probably going to have a struggle sort of managing the public and what that looks like. And so the county has come up with some really great resources that I'm going to share with you. And we'll put the link to these resources in the comments here in just a moment. But this is a one-sheeter for personal services. What does it look like to open a business like a beauty salon? And so we have these for car washes, we have these for the construction industry, and they will be available through the link that we will be providing. But it talks about, how to take customers into the business, how to do so safely, and how to stagger your workforce. And so I won't get too deep into that, but just want to let you know that these resources are available for all different business sectors and that we will share those out to you. All right, it looks like, very quickly before I transfer over to Dr. Joe, if we were to social distance, how can you cut someone's hair? I'm going to save that one for you, Dr. Joe, because you had a great answer for that when we were talking on our meeting previous. And I think that's a great segue over to you. So this is Dr. Joe Adragna, and you've probably been seeing a lot of him if you've been following along with COVID and all the updates. And Dr. Joe, I'll turn it over to you.
Thank you, Chelsea. I'm going to go ahead and share a screen here for us. Okay, so hopefully this is coming up. We're going to run through a PowerPoint just to kind of guide our conversation, then looking forward to answering more specific questions as we move along. So my name is Dr. Joe Adragna. I do carry a lot of titles with the pandemic response, but I'm coming to you as the county's medical advisor, the public health director, the incident commander for the county's pandemic response, and their medical response specialist as well. So let's jump right into it. So our mission at the Emergency Operations Center was originally to save lives when this pandemic response was first implemented. And as we've transitioned, we recognize that we need to save lives and we also need to save jobs. And so we've been really active in working with our contacts at the city like Chelsea and Kate to make sure that we have a plan to safely roll out our public health expectations while supporting businesses to reopen. And so here's our agenda. This looks like a lot of stuff, but we're only going to spend a few moments going through each one of these. It will be somewhat quick, but as you've heard, this is being recorded and we really want to get into your questions and answers first. Maybe this will give you some answers as we go along, but we're going to review our current data, what our projections look like. We're going to review our progression criteria as how we move from phases 1, 2, 3, and so on to eventually getting back to a sense of normalcy. We're going to talk about our approach. I want to focus on your safety. I want to talk to you specifically about masks, gloves, and distance. I want to briefly talk to you about your customers and how you can support them. I want to offer you some resources, and then we'll get into Q&A. So our current data, the green bars here, some of you have seen this in other presentations that we've given, shows you the total case count. This is through the 25th. And you can see that we're approaching 90 positive cases here in Montrose County. The orange line here represents the last 7 days total as of that date of report. We want to see that this is downtrending and going towards zero. We're seeing that. We do expect this to change as people move about and we loosen up the stay-at-home order through the governor's executive order. The blue columns here at the bottom of this graph indicates the number of new reported cases on that date. And understand, reported data is not the same thing as onset data. So if there's a delay in getting testing, if there's a delay in transportation, if there's a delay in reporting, it will get put on one day, even though you may have been sick a week previously or had your test done 5 days ago. So this data here shows in blue columns those new cases that are reported each day with a modification on our April 10th date. April 10th was a date when we got a large data dump because the preceding several days were not reported because of transportation and logistic errors. And so all of those results came in on April 10th. We know that they actually should have been spread out amongst the days previous to April 10th. And if we did that without modifying the total number of cases, we see that our peak was really early April. And this is in keeping with the state's data as well. And Mesa County was late March. So we likely did peak in cases early April. Of course, keep in mind that this does not consider what will happen as we loosen up social distancing as we go forward. The other thing is this trend line that's on the bottom is not indicating a prediction. It has a low R-squared value, so it may not follow future new case counts, and I suspect it will not as we loosen up our restrictions. This is a model that shows what kind of expectation we would have for Montrose if we were to continue at the social distancing levels we have previously been at for the past several weeks under the stay-at-home order, under the assumptions that we have in terms of hospitalization rates, length of hospital stay, ventilator utilization, et cetera. We would show that Montrose would peak in the number of hospitalized COVID-19 patients in early April at a level of 5. And this actually is true. This is exactly what happened. We peaked at 5 hospitalizations of confirmed cases. Now, there's always more cases that are unconfirmed or waiting for test results, or maybe they're in the hospital for totally other reasons than COVID-19. But what this shows is that if we were to continue with that same social distancing efficacy, we would eventually trail off down to 0 cases at the end of May. And then note that the experts who do these modeling on a daily basis tell you that 100% of models are incorrect, so interpret these with caution. This graph here shows if we were to reduce social distancing efficacy to just 20% of where our baseline would have been at. So remember, 70% efficacy is what it looks like Montrose was achieving. This shows if it dropped to 20%, we would peak in late June with about 6 hospitalized confirmed cases of COVID-19. There would be about 4 patients in the ICU and 3 patients on a ventilator. So that'd be late June. How we're going to progress forward from the county's perspective and the public health department's perspective is we want to make sure that we have decreasing or stably low case counts, that we have adequate medical capacity, that we have adequate testing capacity, and we have adequate contact tracing, which means our public health team follows up with those people who have a positive result, and we try and make contact with people or places they've been in the previous 14 days to provide isolation and quarantine education, and offer testing if they meet criteria for testing. We also, this is also dependent on the isolation and quarantine compliance. If we get a bunch of people who are testing positive and tell us that they're not going to comply with isolation orders and they're going to move about and expose other people, that may cause our case counts to go up and our response to change. And we also want to make sure that there's no data or trends to suggest an impending surge or that we're going to run out of PPE, which at this time, things are looking good. We're supportive of this new phase, and we'll continue to follow this data. As Chelsea already mentioned, our stay-at-home order from the governor expired, and now it's the safer-at-home order that was released yesterday from the governor's office, and I won't repeat these dates as Chelsea already repeated those, and there's graphics online that detail them. Our approach is that we want to encourage businesses, we want to support you, and we want to share best practices and information. We are pro-business, pro-safety, and we can do this together. This is not mutually exclusive. We can get back to business while keeping each other safe. So we have business ambassadors that are going to be supporting of your business, and these folks went through training with us over the weekend. You may hear a phone call or an email, or they may come in person to offer some help. They are not coming in with any formal titles. They're not coming in to do a public health inspection of your business. If you don't want their service, that's totally okay, but they can help troubleshoot for you or with you and think of some creative ways to be able to implement some public health interventions while running your business. Your safety is really important to us, as you would imagine, because if you're sick, we can't get businesses going back to full steam ahead. So it's important that we use masks in our business and our interactions with people. There is debate about whether mask use works. Masks do work in Montrose, and the reason for that is that we have community spread of coronavirus. This is, if it was contained to 1 or 2 outbreak sites, and if you didn't go to those places, then maybe you don't need to wear a mask. But in Montrose, we identified community spread, meaning you can get it not at the hospital, not the doctor's office, but just going to any of the stores or any points of congregation. And so a mask will help to decrease that spread. It also is important when you have such a high amount of asymptomatic or mildly symptomatic people that may be spreading that virus unknowingly, and the mask helps to prevent that. So when you see someone wearing a mask, it's really more about them protecting you than protecting themselves. If they are a carrier and not knowing of that, they will not be spilling their saliva and viruses out on surfaces or contacts as they breathe or talk or go about their day. So I like to think people that have a mask on, some people see them as someone that's sick. That's not how we should view it. They're protecting you. They're doing their part. We also know that if we can keep our separation at 6 feet or better, then we decrease the spread. Of course, remember that surfaces can be contaminated and the virus can live on surfaces for up to 5 days, depending on the type of surface it is. And so we still need to maintain good hand washing techniques and use hand sanitizer if we don't have the ability to wash our hands. I'd ask you guys to speak up in your businesses. If you have a sick employee, I wouldn't have them in your place of employment. That doesn't change. We should have been following those rules all along. Now we just have a heightened awareness of it. And so if your employee is sick, we encourage them to stay home until they have a clearance from their provider that they're not contagious, or they clear up their symptoms. Also, we have put out on our website and I'll share that website here in a moment, but there is a template that you can use to screen your employees. If you don't have a thermometer, they do sell various forms on Amazon that you can get. The non-contact ones are preferable, but if that's not available, then any thermometer is better than none, as long as it's being used safely and appropriately. We also would ask you to watch for congregation points, and we would ask you to keep venues in mind. We do not want 10 or more people is prohibited according to the executive order from the governor. So it's 10 or more is prohibited, 9 or less is fine. Next, about mask use. So this is referencing Public Health Order 20-26. We are anticipating a new public health order to come out today from the Colorado Department of CDPHE, Public Health and Environment. So for mask, I'm referencing this older order pending the new one, but it said that it was required for employees of critical businesses and critical government functions. Now we're starting to roll out non-critical businesses, but I would encourage you to still wear a mask, and the new order may require it anyways. It'll be good for you, your employees, and your customers. The mask should be worn if you're going to be working within 6 feet of other workers or in contact with the public. Also, it requires that you wear a mask if you're preparing or handling food that's going to be made available to the public. And mask use is required at all times in congregate care settings. If you're out, some people have asked, if I'm out by myself doing landscaping in my front yard, do I need to wear a mask? No. I mean, if you're by yourself and you're outside, there's plenty of distance. You don't need to wear a mask. For gloves, these are encouraged but not required according to the current public health order for most businesses. I would encourage you to think about this and the difference between a public health intervention and a personal health intervention. I have a lot of concerns about pushing glove use too aggressively for general business use, because I'm worried that it will decrease hand washing or hand sanitizer use. Gloves can be contaminated just like your hands can be. So it's important that if you are using gloves, you are changing those gloves out between customer contacts. Or if you're not directly interacting with customers, but interacting with their items, then you may need to change them out on a regular basis as well. They are required for food and childcare industries as normally required by their governing regulations, and they're required for your employees that are directly involved with disinfection. So if you've got somebody going around and cleaning with bleach or some other solution that's appropriate for coronavirus, please encourage them to wear gloves. That'll decrease a complaint of injury and will decrease their risk of getting the infection as well. For general distancing principles, we would encourage you and your employees to maintain 6 feet of separation. So if you need to reconfigure your workstations or your office desk, your seating arrangements, please do so. And then to limit the density of your staff, you may need to stagger shift, change your hours, or change your days of operations. And I would ask you to be a model for your customers. If they see you doing it, they can also take it back to some of their operations and in their own interactions. For your customers, we ask you to encourage them to use a mask. You can do this through signage, announcements, website, printed materials, maybe offering a coupon for those that do wear a mask. We would ask you to support their maintenance of 6 feet of separation in your lines. Look to your waiting rooms or chair placement. Consider one-way aisle creation. And then we would ask you to discourage patronage by the sick. So this can be done through signs or announcements as well, and offer alternative methods such as shopping online, delivery, curbside pickup, preferably to healthy family members and not the sick person. Here's a list of resources for you. We'll get this out in a PDF form with Chelsea, who can share this. And but you can go to Montrose County's website and the City of Montrose's website, and that'll get you linked to all of these other resources. But we do have a safer at home guidance. It's published as a draft pending the new orders from CDPHE. We have the employee screener for illness, and then we have a joint information center that provides lots of good information. We also have the Western Slope COVID information site that will give you information about different counties, because each county does have their own rules at their discretion to implement more strict rules than the governor or CDPHE orders have put out. There's also an email address on this PDF that will go out that you can get in contact with the public health department if you have a specific question about your business or a concern, and they'll help walk you through that. Again, the public health department is supportive of your business. They want you to operate. They want you to do it safely and within the laws that are being put out through the state's executive order and CDPHE. And that's the end of my presentation, Chelsea.
Great. Thank you, Dr. A. That was really wonderful information, and I think provides some solid guidance for how each business can start to think about opening. So I'm going to go back to one question that was health related before we get into the business specific questions. And we had a question asking if you think we will peak again or see an increase in cases as a result of this decreased social distancing.
Yes, I think we will see increased cases, and hopefully our projections indicate correctly that we won't surge our hospital capacity, but we're going to be following that. Every morning we have a meeting with city and county representatives to go over the data. We also meet with the hospital regularly. We have been meeting with the hospital twice a day, sometimes more, and we'll continue to meet with all of the stakeholders to make sure that we have up-to-date information and can act quickly. With that being said, I want to remind everybody that there's a delay. So if you get exposed today, most likely you're not going to show symptoms for 4 days. It could be up to 13 days. And so if you look at Easter Sunday, that was April 12th, we think that there was quite a few people that didn't follow the existing stay-at-home order, and so we had an increased case count that showed up on the 25th. Actually, it would have been the 24th, but there was a one-day delay in the state's lab for reporting. So at 14 days, we saw an increase in cases. Why 14 days? 4 days for symptoms, and then the average date of onset of illness to the date that the lab is reported is 8 days right now, because it takes time to get into the doctor's office or to get a test done and then to get the test result back. And so somewhere between say 6 and 14 plus or minus a couple of days, you can see an increase in case counts. I expect we will see some increase in case counts. If the models are correct based on the information we have today, we may see increased cases late June. And then we don't know what will happen in the fall. There potentially could be more cases then as well, but we'll see. It all depends too on our herd immunity. If more people are exposed over the next couple of months as we do decrease our social distancing and we build up immunity against the SARS-CoV-2 virus, we may be better protected as we enter into the fall.
Thank you. One thing that we talked about on, I think it was Saturday when we were meeting for our training, was an idea or guidelines for thrift stores as they are starting to receive used goods. And I know that the hospital has been practicing something very similar right now as they're receiving goods. So give us your thoughts on how to receive used goods and what to do about that so that it's safe.
It's a great question. So that goes back to the concept of the fomite. So a fomite is a non-living contact, a surface, a desk, an item that has the potential to spread infection. So basically, if you keep it, if you look at the longest time that we expect, it would be about 5 days, depending on the surface. That'd be metals. Paper products tend to be about 3 days. Wooden desk are about 4 days. And so my general rule of thumb here would be if you take an item from the community and you let it sit for 5 days, after that point, you should be relatively safe to handle it at that point. So just let it rest in the corner for 5 days and come back to it.
Great, thank you very much. All right, can you address thinking about social distancing while also doing a personal service like cutting hair and what we're looking at with that?
Yes, perfect. Thank you. So it's important that we remember too that social distancing, it relates to social interactions, and our goal is to minimize those contacts as much as possible for the time being. We recognize that personal services still need to occur. You need to still go to your doctor's office, and they have to break that 6 feet of separation. Maybe you go to your chiropractor, or maybe you go to someone to cut your hair. So we can be smart about this. It's not you interacting with 50 people all at once, which the point there would be is if there was a positive case, it would overwhelm our contact tracing capacity. But if you had one client every 20 minutes that you were taking care of, then that limits the exposure. It's still not ideal. It's still a lot of people, but it's still within reason. And so I would encourage that the person with that close contact wear a mask themselves as much as they possibly can when they're interacting. Wash their hands between contacts with customers. Wipe down their surfaces with an approved agent. That approved agent can be found in our guidance that we published. You can also find it on the CDC website for different materials or solutions that will clean and disinfect. If you practice that, if you practice mask use, hand hygiene, and wiping down surfaces between your customers, I think that you are safe. If you look at the guidance put out to healthcare workers, and you look at their risk of getting the illness in the event of an exposure, they define it as, was there source control or not? So they say if the person you're taking care of is wearing a mask, it can be a cloth face covering, and you've got a cloth face covering, even if they have COVID-19, you are very unlikely to get that illness. If you have prolonged close contact, you still have low risk as long as both of you are wearing masks. So keep that in mind. So then let's say they are no longer wearing a mask. If they're asymptomatic, they're not coughing all over the place, your risk also goes down. If you have somebody that you're worried they're coughing, they don't look well, they're sweating quite a lot, maybe they have a fever, it's okay to say to them, look, I'm worried about your health right now, and I want to reschedule our appointment. That's okay to do, just like we would ask our employees not to come to work if they look the same way, if they're coughing, if they don't look well.
Thank you very much. And when you shared the illustration over the weekend about how you sanitize when you're in contact with a patient, how many times you use hand sanitizer as a doctor, I thought that was a really great illustration of that. And we can get into that a little bit later if we'd like, but I'm going to keep going with the questions. What about massage practice, Dr. A? How do we feel about medical massage?
Yeah, so a medical massage does, it generally is not going to be a high splash risk, like maybe going to a certain spa type of setting, although we need to be cognizant of that. If you are using lubricants or oils, make sure that you are minimizing splash risk. And if there is a high splash risk, reconsider using that solution or put on some safety goggles. But personal contact in that manner, using appropriate PPE use, using your cloth face mask, PPE, personal protective equipment, and washing your hands should be just fine. Now, if you have open wounds or cuts on your hands, that puts you at risk. And in those cases, I'm a big fan of using gloves. And the public health order would encourage you to use gloves right now in that case, no matter what, even if your hands are not cut or raw. But again, wash your hands, don't touch your face, use a mask, you'll be fine.
Great, thank you. Next question is a little bit back toward the medical side, and actually maybe we can lump this in with another question we had in the chat. So what are the criteria for testing? That's part A. And then part B would be, can you talk about what the hospital's capacity is at this time and what our response parameters are to that effect?
Sure, I'll tackle the hospital capacity first. This is something we track every single day because it influences our decisions as well. So the hospital has capacity to continue normal operations up to about 50 hospitalized patients. Keep in mind that they have not gotten above 5 confirmed COVID-19 hospitalized patients at one time. Now, that doesn't mean they didn't have a whole lot of other patients that were pending their test results, but the majority of those have come back negative. So at one point, we had 15 hospitalized patients at Montrose Hospital who either had confirmed cases, confirmed COVID-19, or were pending their test result. But once those results came back, we never saw more than 5. They can go into overflow capacity up to 75 hospitalized patients. And then the county has worked with the hospital to set up what's called a tier 2 alternative care site that would increase capacity by another 50 beds in the event of a surge. I can assure you that if that happened, we would be back to very strict county public health orders, because we do not want to care for people on a cot in a gym that need to be in a hospital. But we are prepared in case that does happen. We also have a 50-bed capacity in a tier 3 alternative care site, which is for subacute level care, people that don't need a hospital yet, but can't go home either. And then we also have up to a 50-bed non-congregate shelter capacity as well. And then Chelsea.
Testing.
Testing, thank you. So we are following the CDC guidance for testing. They break these into 3 criteria. And Montrose has been doing priority 1 through 3 testing now for weeks. Priority 3 is where most people will fall into. So that means that you have no risk factors like, say, COPD or asthma or heart disease, but you have symptoms that are consistent with COVID-19. You would qualify for a test. So for example, if you're a 30-year-old healthy person, you've got cough and low-grade fever, and your doctor can't otherwise explain why you have that, you're a candidate for COVID-19 testing. If you are exposed and you're part of our critical infrastructure workers, maybe you are critical to us maintaining our water supply in Montrose, or you're a healthcare worker and just exposed, you don't have symptoms, 4 days after your exposure, you qualify for testing so that we can get you a result, and if negative, you can get back to work. If you have mild symptoms that are not consistent with COVID-19, but you work in healthcare, we will test you. So the testing criteria is pretty loose, really. The ones we don't want to push would be the person who says, I was exposed 21 days ago, I feel great, but I want to test. You're not a candidate for a test. You've gone beyond quarantine at this point anyways, and we wouldn't have any utility in testing you. If you're a hospitalized patient with symptoms, you'll definitely get tested. If you're a healthcare worker with symptoms, you'll get tested. If you are a person with risk factors and you have symptoms, you will get tested. If you're a first responder with symptoms or a first responder with exposure, you will get tested. We are very fortunate in Montrose right now to have the testing capacity that we do. Most counties that surround us do not have that capacity, and that's a testament to Montrose Hospital.
Thank you. I think we're fortunate in Montrose in a lot of ways. We've had some really great response to all of this and some great teamwork across the community. So that's just an aside. Thanks for answering those questions. I think that maybe Kate, that'll answer Amanda's question now for 2. And then the next question is about sort of tourism. And it's been a hot topic in a lot of different meetings that I've been a part of. Carol, to answer your question, hotels are able to be open and have been able to be open the entire time. With RV parks, I think that that's been along the same lines, but Dr. A, do you want to just sort of address the idea of RV parks, hotels, and tourism as you see it? And I can address the second half about when tourists start coming into the community.
Sure, thank you. You know, we, again, going back to this concept that we are supportive of businesses and operations, we want to focus back on what's the public health risk. If you're going to a hotel, which allows for isolation really within that hotel room, there are opportunities for congregation in, say, conference rooms and things like that, but our executive order limits that to 9 people or less. We feel that those are very reasonable places to operate. They always have been in Montrose. We've not shut them down like other counties did. In fact, we relied on those hotels to help us in the county set up a non-congregate shelter option for our community, which luckily we haven't had to activate. But if it wasn't for them, we wouldn't have had as many opportunities there. Now, many of our hotels chose to shut down because of economic reasons, but that was not by any public health order of Montrose. So I would support them. Same thing for RV parks. There's lots of distance. It would be reasonable.
Thank you very much. And then to answer the other side of that question, just about what it looks like from a tourism perspective for the city of Montrose, you know, we've been keeping in very close contact with the Colorado Tourism Office and talking about the strategy moving forward. And it's interesting that the state of Colorado is thinking along the same lines that we've been thinking in Montrose, and that's sort of a turning inward strategy. So we're going to look to our neighboring communities when travel does become a little bit safer, thinking about attracting people for weekend trips from places like Denver, from places like Glenwood, to come to visit Montrose and get some of their Colorado bucket list activities checked off, where they can, number 1, travel for less expense, and number 2, travel for a shortened trip that's within driving distance, and perhaps camp, where people might feel safer doing that as well, which would click right into the RV parks. And so that's sort of the sentiment statewide, is that we'll start to see that really localized regional travel first, and then all of the international travel and those sort of things will be much later as this process unfolds, with other markets having a lot more severe impact than we've seen in Montrose, and those travelers not coming to the area anytime soon. Other things to consider are that many of the festivals in Telluride have been canceled for the year, and so that's going to decrease a lot of the travel into our area. And so this is just an opinion, but I would say that this summer is going to be a lot lower in terms of traffic into our area, just because of those specific things in general, of the events being lessened and fewer international travelers coming. Doesn't mean that we won't see them, and it doesn't mean that we won't have a decent a decent economy this summer, but it does mean that it's not going to look anywhere near the same because of the lack of those travelers for the festivals and the international travelers. All right. Dr. A, we have a question from Rose saying she saw a bullet about childcare, but can you tell us more about the recommendations for safely reopening childcare? And I know a lot of providers have been open the entire time, providing care for essential workers, but just some ideas on childcare and what that might look like.
Yeah, that's a good question. So I do appreciate those childcare operations that were able to stay open for our critical workers. That was a big concern from the medical staff early on, was if we don't have childcare, then we can't go and serve the community. So for everybody that was able to stay open and made that work, with the many people took heat for doing that from community members that thought that was unreasonable. They maybe didn't consider all of the other consequences of shutting that down. So thank you for what you did. We can use what they've done as an example for what we can do going forward. They limited classroom sizes to, at this point, I would encourage you to try to keep it to 9 or below. I would encourage educating your community, your employees about the importance of hand hygiene, hand washing, and hand sanitizer use. Also using gloves when in close contact, and to wear a mask. If the people that you're caring for are age appropriate to use a mask, I have a 4-year-old, she loves her mask. If she'll wear it, long enough, that may provide some protection. I doubt you'll get a bunch of 4-year-olds to wear a mask for very long, but you could certainly try and make some games out of it. Bottom line is hand hygiene, limited class sizes, at least the teacher or child care employees wearing a mask, and then really frequent contact cleaning. So getting all the knobs, all those surfaces that the kids touch or that they interact with, the toys, etc. Another thing some of these agencies did is they limited the types of toys that could be brought in and limited the quantity of toys that could be brought in from the household. And I think that can make a big difference as well, because you can expect that any one of those toys could be carrying a pathogen on it. And so if it's a type of toy you cannot clean or wipe down, then you may not want to bring that in just yet. And if they're bringing in a whole basket of toys and they can do with 1 or 2, I would try and limit it to just those 1 or 2.
Wonderful. Thank you very much. Let's see. Oh, pickleball. So we have a question about pickleball.
Yes.
Not the first time this has came up, Paul, so don't worry. Assuming 6-foot separation, a sterilized ball, do you think doubles pickleball can be safely played outdoors?
Yes.
Okay. Awesome.
With people that are not sick. I wouldn't want somebody who's, yeah, I'm fevering today and I've got a cough, and then I'm going to go have them spit all over me while we're playing something. If everybody feels well, they haven't had a known exposure in the last 14 days, you're outside, you're maintaining distance, that's very reasonable.
Great.
The other Chelsea, I guess I'll say there is, I know some people on this call right now will be worrying about this. Don't go and get 50 of your closest friends to watch you play. That would not be appropriate unless it's on Zoom or some other online media.
Yeah, totally. Love this dressing room question. So I'm going to get to that one, and then we have some other questions. Should dressing rooms be open to the public, and should those items be returned to the floor or placed back to process for 5 days?
I think if you can do that for 5 days, that would be reasonable. If you can only do 3 days, that seems sufficient as well as a cloth surface.
Okay. And then, of course, if they have concern over that, they could just keep the dressing room closed for some time until things are a little bit safer as well. I think people would certainly understand that. From David Fishing, is employee screening encouraged or mandatory?
That's a good question. So for most of the businesses in Montrose, that is going to be encouraged. For let's see, I'm looking at the safer at home order right now. So there is language about a large size business of 50 or more. Let me just pull that up, unless you have it up, Chelsea.
No, I don't.
No problem. I'll get it here in just a second. Okay. Okay, so the exact language from the governor's executive order is ensure that critical businesses, critical government functions, non-critical commercial businesses, and non-critical retail with over 50 employees in any one location follow protocols established by public health order, including but not limited to symptom screening and temperature check stations, closure of common areas, cleaning protocols, and mandatory social distancing requirements and protocols. So the public health order just got uploaded, number 20-28, and literally, I think as we were starting this presentation. So I haven't reviewed that yet. It's 34 pages, and I'll have to review their language, whether they say that's mandatory or not. But here's the point. It's unlikely that the Montrose County Public Health Department is going to send an inspector. Not impossible, but unlikely. We're going to go out there and say, you've got 50.5 employees. I'm joking a little bit. And I don't see your screener, and it's use your best, your common sense, your good judgment. We basically feel that most employers in our community want to do the right thing, because if your employees are sick, they can't do their job. If your customers are sick, they can't patronize your business. So we're all in this together, and I expect our business community to be leaders in our response to the COVID-19 pandemic and help us to get this under good control and keep it under control. So I would encourage all businesses to be screening your employees. We implemented this really early within the healthcare industry because we didn't want for example, our general surgery office to be knocked out. If all of our general surgeons were knocked out from COVID, who's going to respond to your car accident trauma case at the hospital, right? So we went through very early and made sure that the clinics have the resources. I would encourage all of your businesses to implement this, even if it's one person. This sounds crazy, but what do pilots do before they land their plane? They've landed their plane a million times. They still pull out a checklist and make sure that they go through their processes and don't forget something. You'd be surprised how many stories we've heard of the person who was supposed to be doing the screening at a job site was the one that was sick. They forgot to screen themselves. So even if you're a one-man show or one-woman show, check yourself, make sure that you don't have a fever, you don't have a cough, you don't have shortness of breath, that you're feeling well, and then go to work. And so I would encourage all businesses to do this.
Thank you. I wanted to do a go back really fast on a couple things, and then we'll get to some more questions. We talked about pickleball. That's more of a one-on-one, two-on-two type of sport, but we need to remember that organized team sports like baseball, football, basketball, where larger groups start to congregate, audiences start to congregate, we will not be allowing that within the city, because we're going to wait until we get to the sort of the line where groups of 50 or more are allowed. So we're really wanting to keep that, at bay right now. And we know that the weather's getting really nice and people want to get out and do, play soccer together and those type of things. But please, refrain from doing that so that we don't have people in close proximity or large groups of people starting to congregate as this unfolds. So this is, today, this order is safer at home. Really, the idea is still, if you can stay home, please, keep on with that, because the more of us that can continue to stay home, City of Montrose employees are still all working from home as much as we can, and we're trying to practice that. The other thing too, to remember with travel and tourism is that the governor is recommending, and the state health department, that we stay within 10 miles of home. And so, if you want to, I saw some people over the weekend actually camping sort of down the hill from their house and, getting really creative about ways to do that, to recreate within close proximity to the county. So those are just the recommendations that we're under right now. And so hopefully surrounding communities are respecting our community and not coming into the community to recreate, and vice versa. All right, let's get to some next questions here. What are the benchmarks for getting back to normal? Is it 14 days declining? Are there triggers for opening so we can, as we see more data, what does that look like?
It's a really good question, and we're not going to use just one data point because if we have decreasing case counts, but everybody who gets it is more severely ill and they're taking up our ventilators, we may have to consider that. So we don't have one criteria. If we run out of personal protective equipment, how does that affect us? If we run out of hospital beds because there's a mass casualty incident that has nothing to do with COVID-19, how does that impact us? There's a lot of these different things that we're going to be considering, but it's going to be, what are the case counts looking like? What's our our hospital capacity? What's our PPE, our personal protective equipment supply look like? Do we have capacity to continue with contact tracing, quarantine of those that are exposed, isolation of those that are sick? And what are we doing with social distancing efficacy as a community? If our community right now goes back to 100% normal, there's some projections that model that we would take our hospital capacity to probably its limit. But what if it went right over that limit and your loved one was the one in a cot in a school gym? I'm not saying that to do any fear mongering. It's just that we cannot use one data point to answer that question. We have to consider all of them.
Thank you. And I think that stems into the next question, which is when restaurants will be open. We don't have any hard data on that. The governor has said things like mid-May, those type of things. But as we mentioned in the beginning, Montrose County and the city of Montrose can choose to be more restrictive than what the governor is saying if our community is seeing a spike or, more instances of cases. So it would be great if everything goes really well and we can get restaurants opened within the next 15 to 20 days, but we do not know that for sure, but that is what the governor has said. We had some other questions about hand sanitizer and masks, the use of commercial grade masks for hair stylists and those type of services. So the county has been working on a project to sew masks, and they have several available. So as our business ambassador team starts to come say hello, make phone calls, we will be able to provide masks to the most critical need businesses first. And so we have some of those on hand. I think there's limited hand sanitizer. There's also some resources in the comments that we will send out after this call, talking about places that you can get hand sanitizer and other supplies here locally. I know Colorado Yurt has pivoted a lot of their manufacturing to get PPE out, and then there's some other places that are manufacturing hand sanitizer. So there is availability of that. Reach out to us at the city and the county through the website that I sent out or by calling or emailing us, and we can get you supplies if you need them. And I also forgot to mention at the beginning of the call that this one would be going longer than 30 minutes. Obviously, we're already past that point, but we wanted to provide good time for Q&A. And so this one is about steaming clothing, Dr. A. So the general consensus would be that consignment stores steaming the clothing would kill the virus and that they could put the clothing onto the floor immediately. Thoughts on that?
Yeah, I actually support that. That's a good idea. We know that that you can heat the virus and kill it. I don't have a duration that I'm aware of right now that's been studied that shows what duration of steam has to be applied for to get an adequate kill. We know that 70 degrees Celsius for 30 minutes will adequately kill the particles. You're going to be at 100 degrees Celsius on the steam. And so, I don't know how many minutes you have to expose it. I guess there's so many factors that go into this, right? Because, it depends on whether somebody who had COVID-19 was actually in contact with the clothing item, whether they spread it onto it. Maybe they didn't, maybe they have it, but they didn't spread it onto the clothes. So I think we just have to use our best efforts and our common sense on this. If you can apply the steam for a minute, do that. If it's 10 seconds, maybe it's less effective. I don't have an evidence-based number to give you of how long you'd have to apply the steam.
Thank you. We have a question about restrooms on golf courses. And I know from the conversations that we've had as a team that the restrooms, to my knowledge, will be remaining closed. I don't know if you have anything further to add on that.
I don't have anything further to add on that.
Okay. It looks like we have a question. People are not wearing masks at our drive-up window. So we've got customers coming to a drive-up who are not wearing masks as a customer. I would have customers wear them. Is it required? And this is the liquor store, a liquor store where people are driving up to receive goods.
It is not required that the general population wear masks. at this point, unless the new public health order changed that. I have not, like I said, I have not read every word of that order. It just got put out during this call. However, we know that if somebody has COVID-19 and the person does not have source control, they're not wearing a mask, but you are wearing a mask, you are considered low risk if you also wear safety goggles. So if you're really worried about this, put on safety goggles and a cloth covering, and you'll be doing what you can.
Thank you. Public restrooms in a small business, same question. I know that we discussed this over the weekend, and I'll just quickly address it. It'd be best to keep them close to the public, but if you've got someone who needs to use the restroom, it's perfectly understandable that you would be accommodating to that. You know, somebody, just use your best judgment, try to be safe, try to use safe, you know, cleaning practices. But while we're under these current orders of safer at home, I think it's best to keep restrooms closed to the public and also be cleaning them for staff use. Would that be where you're at with that, Dr. A?
Yes. Yeah. I mean, again, it's a public health thought, right? So you let one person use your bathroom, and if you adequately clean, that's not presenting much of a public health risk.
Okay. Nolan, I see local fly fishing shop doing guided fishing trips. Are these trips allowable at this time? Generally, there are 3 people or less for approximately 4 hours. So that would be under the same discussion that we've been having with dance studios and those type of things. If you can do a fishing trip with people being 6 feet apart, which I'm not sure how that might be possible riding in a vehicle together, but if they wanted to self-transport and stay 6 feet away from one another and it's within 10 miles of Montrose, then I suppose that would be something that would be okay. Let's see, we've got 2 more questions and we're going to try to get this wrapped up here. I take all precaution and do my part on sanitation, following the rules. Say a client claims to get it from your place of business. How can you protect yourself financially, since most liability insurance companies have a small clause not covering virus since the SARS?
I don't think that anybody is going to prove that they got it from your facility unless you've been designated as an outbreak site. And if you have been, then public health from the local public health department and support from the state will be in contact.
Thank you. And last question here, can we be less restrictive if Montrose is improved beyond what the state sees? Are we following the state and only willing to deviate if we're being more restrictive?
At this time, yes. We agree with the governor's order and what we expect to see in this public health order. Again, we'll review it in its entirety and make sure that it still fits. You know, Montrose is not the same as Mesa County. Mesa County is likely to or has already applied for a waiver to some of these restrictions. They have a 4% positive case rate in those that are tested. We have an 11 to 15%, and we have more cases. And it's not necessarily just because we're doing more testing. Mesa County is adequately testing. They just do not have as much of the virus in their community as we do. So we're not the same as Mesa County. We're also not the same as Denver County. And so we'll continue to evaluate these, again, with the intent of saving lives and saving jobs. We want to get the businesses back open. And if we can be less restrictive than the state's order, then we'll take appropriate action. I can tell you right now, though, if we applied for a waiver, we wouldn't get it because we can't show that we've had 14 days of consistently lowering positive case rate. The other challenging thing there is we have only a few positives per day. And so there's, you know, if you went from 1 to 2, that's not really that significant in the grand scheme of things. But if they're really, I don't know if they were really hard and fast on that, that's not 14 days of consistently decreasing cases. Essentially, we'd have to get to the point where we had 0 cases and it just maintained. And that's likely not going to happen for some time.
Thank you. The last question we had was about martial arts and gymnastics and when we expect those to open. And those are more of a contact type sport. And so I think we can expect a little bit more delay when it comes to those type of things, martial arts and other things where you're touching people, where you're sweating, where you're exchanging fluid and that type of thing. Do you have any expectation on what we would be looking at for that?
It's hard to know. I mean, you know, with the county following the lead from the state, as soon as the state would allow it, then the county would most likely allow it as long as we haven't met any stop points. But it's all up in the air. It sounds like the governor wants to reevaluate things every couple of weeks and then make a decision. So we'll let you know as soon as we know more. Also, Chelsea, before we do wrap up, I see a message about mask use and salons. Can I comment on that? The public health or the new one, 20-28, does not require medical grade face mask for those under personal services. So if you are a hairstylist or similar, it says both employees and customers must wear at least a cloth face mask, a face covering, or a medical grade mask at all times. If you have access to medical grade masks, those are good. But if not, that's totally fine. And this is what I use. This was sewn by my neighbor a month ago, and it's just a cloth mask. This is what the doctor is using. And so, I mean, if it's good enough for me, maybe it's good enough for you, but maybe not. Maybe you think I'm crazy. But I feel comfortable with this in most cases. Now, if I'm caring for someone that has COVID, this is not good enough. I know I need to wear something more that's high grade. But for general public, when I'm out and about or I'm going to meetings, this is what I use. And so I think a cloth face mask, a face covering for those in the personal services industry is going to be reasonable. If you have somebody that is sick, please don't provide them services. Be kind and say, look, I'm worried about your safety and ours. I'd like to reschedule. And they hopefully will be reasonable. Of course, there will be some that will not be, but you have to protect yourself. And remember, personal protective equipment is actually one of the least effective measures at intervening in a pandemic. The most effective method is elimination of the infectious source, meaning separation. Keep them home, you do your thing, they stay at home, they come back when they're well. If you have somebody that's sick and you think you're 100% protected because you have the right mask on, you're wrong. There's still a chance you're going to get sick.
Thank you. And I need to clarify here on gymnastics. It sounds like a lot of the gymnastics gyms in town are going to use a no spotting policy right now, which means no touch. And if they can maintain the 6-foot social distancing, it sounds like Montrose County has approved that, just like other gyms that can maintain the 6 foot with no more than 9 people and I'm inside at all times. And so that's a clarification on that, as long as people are not touching. And they are able to maintain that distance. Give me 1 second. I'm trying to find the last question here. But in the meantime, you, Dr. A, for spending your time with us. This is some great information, I think, for everybody. And it's just been really beneficial. And we have more where that came from. So if you're on the call and you've got specific questions, please do not hesitate to reach out to any of us. And yes, we will be sending out the employee screening checklist. The website that we shared at the beginning with the business resources, there's going to be the employee screening checklist there, and also the ideas for each different industry type of how to keep your staff and your customers safe. So all those will be sent out. Kate will be sending out a summary of all of this with all the information. And we thank you all for being here. Thank you, Dr. Joe. Thanks, Kate, for moderating with questions. And we appreciate you all. We had over 100 people on this call this morning. So it was well-needed information, and thank you.
Thanks, everybody. Appreciate your time.
All right, thanks. We'll see you next week. Bye-bye.